Yeah, Jennifer Aniston.
Yeah, you like Jennifer Aniston?
Yeah, she's like America's sweetheart.
That's what I wrote
original
on the
one.
very front line of my card.
Yeah.
It's like one of America's sweethearts.
Yeah.
So did you guys watch Friends?
Uh-huh.
You did watch it?
Yes.
I watched it, but not like all of it.
Yeah, like reruns and stuff?
Yeah.
Yeah. Yeah, you know, I wasn't so Friends was like my wheelhouse
Yeah, we
growing
watched
up.
it whenever we
Yeah.
had to wait a week, every week, and then it was gone.
Really? So, so I was, guess, 20 whenever Friends, because it came out in 94, so I was like 20 when...
Yeah, I watched it with my sisters.
Yeah, when it came out, but I just was not a huge fan of it. I mean, I did watch a few episodes, or sometimes I might be dating someone that watched it. I wasn't the biggest fan, but I did sporadically follow, and plus everyone was talking about it all the time. Mm-hmm. So it's almost as if you didn't watch it, you kind of felt left out.
Yeah.
And then everyone would ask, you know, there was the big debate, oh, do you like Rachel or Monica? I was actually kind of a Monica fan over Rachel, meaning Courtney Cox over Jennifer Aniston.
Well, your wife has more of that aesthetic.
That's true. She does look a lot like Courtney Cox, yeah. Okay, so this is a segment about Jennifer Aniston and her revealing her plastic surgery that she has and has not done. And, you know, she's been the subject of plastic surgery rumors for a long time, mostly because she looks amazing. And of course, you know, people that see someone that looks so great oftentimes want to think, oh, well, they look great because they've had a lot of plastic surgery. Yeah. And she does look great. She's 56 now, reported 5'5", 117. I mean, she's like holding her body like indefinitely in this absolutely, you know, peak physical form. But she did open up very recently about what plastic surgery and aesthetic treatments she has and has not done in a article in Glamour magazine. Mm-hmm. And I have a picture of her from Friends. I was going to throw that up there. There she goes. There she is in Friends. Yeah,
I remember the biggest rumor whenever I was a kid was that she had a nose job, and like everybody could tell that she had a nose job from like the first season to like the next one.
Yeah, definitely. She definitely did have a nose job.
Yeah, for sure.
The question is when and if she had more than one, but she absolutely had a nose job.
Did you know that she's Greek?
She is? Mm-hmm. I didn't know that. I did not know that. No.
Yeah.
Interesting. I mean, she's not from Greece, right? Her family.
She's Greek heritage.
Yeah, Greek heritage.
Yeah.
I didn't know that. Yeah, excellent. Also, so these questions of her having plastic surgery were also brought into question in the past year or so because she was spotted outside some well-known plastic surgeon's office with Sandra Bullock, of all people. I guess they're friends. And so, of course, they're saying, oh, well, you were outside a plastic surgeon's office. You know, are you having plastic surgery? That's why that you look so good. So in this article in Glamour magazine, she kind of went into what she has and hasn't done. And I have to say that this is kind of what I figured for her. Nothing to me was surprising here. So, well, one thing is surprising. The first one, Botox. So she says she has had Botox in the past, but she felt like it was not her thing. Mm-hmm. And she kind of indicated that she hasn't been doing it regularly, which honestly, I honestly find that hard to believe. When you look at her, she does not have the wrinkles, you know, in the glabella area, the forehead, or around the eyes that are very, very common at people in their mid-50s, which are basically not going to happen if you do Botox.
Yeah, but she doesn't really have that big of a forehead. Like my mom has like a smaller forehead, and she's older, but she doesn't really have very much wrinkles on her.
I mean, that probably
like
does make a difference. Go up that the title page one more time. No, not that one. Go back to. There's a good picture of her kind of close.
I don't know. Like I can't really see it because the numbers on the screen.
But
I always thought she had like a smaller forehead. Like she doesn't have like.
I think she has like a normal forehead. So she's like a 3-head. Not a 4-head or 5-head.
Yeah, like my mom's forehead's kind of like a 3-head. Short. I always tell her that.
I mean, you might be right. I've actually never dug into just the height of the forehead.
Like, I don't know. She could not just be like that expressive. Like my mom does not.
You know,
I don't know.
Honestly, I think that's why I don't have a lot of wrinkles. I really don't for my age. I'm just barely starting to get my forehead, but I don't feel like I'm super expressive. I mean, maybe on the show I am, but when I'm just being me, you know, at home or at work, I'm not that expressive either, and that's one of the reasons I haven't really started Botox. I don't feel like I'm getting the lines that I probably should be. And so, yeah, maybe it's genetic with her as well, but it looks like she's been doing Botox regularly, but she says she hasn't. And she seems like she's pretty honest, so I'm going to give her the benefit of the doubt. She's always been accused of having a breast augmentation. She says no. I agree with that. I mean, to me, her breasts look natural.
Yeah.
You know, I think that's a pretty clear one. She says she does hydrofacials.
Yeah.
Which is good. I mean, getting the oil out of your skin is always beneficial to making your skin look bright and making it look younger. Obviously, that's not surgery, but it is aesthetic. Now, here's the one that I really thought that she was doing, and I think is playing a big part in how she looks so good. She says she does like lasers. She does laser treatments on her face and neck. And I've said this on the show many times. I think that the laser treatments, you know, depending on which one you get, if you get like a heavy laser treatment, well, depending on your age, obviously someone like yourself would not need a heavy laser treatment. Someone like my age would need a heavier laser treatment, but maybe not the heaviest. But I think that the lasers are a fantastic way to make yourself look youthful into middle and even further ages. You know, and you can do them as maintenance, meaning you don't just get one laser treatment and never get one again. I mean, you can, and you'll get benefit from it, but you can repeat them.
Yeah, what's like when you get a laser treatment, like how long do you have to wait for like
a year
to go back? No.
Oh, you mean like when you do the series?
Yeah, like after you do it, is there like a wait time for you to like wear makeup again, or like?
It totally depends on the laser. Yeah. You know, so for example, the one that we have that I really like and I tend to do every year, although I didn't do it this year because I did a different treatment.
I haven't seen your face all red yet.
I know, I need to do it. Well, I did the Morpheus this year, and then I got out. I have to go back. I need to redo everything. I'm going to do it this fall. Okay. Anyway, there's a laser we have, which I really, really like. You will extrude oil and be swollen for 3 or 4 days.
Okay.
And so you really want your skin to kind of calm down before you like use makeup again. So, you know, maybe 4 or 5 days before you do that. But they vary, right? So the Moxie, so the one we have is Halo, which I love. Moxie is like the one below that. It's got a shorter time frame, you know, like a day or two. So as far as, you know, your downtime, it totally depends on the laser.
Okay.
Have you done one? Oh, you haven't? If you ever want to do it, just let me know.
Oh, I know.
Not that you need it, I'm just saying.
Gosh,
but it is.
Dr. Bruce, I'm just kidding. No, but I need to call and do Botox too again.
Oh, is it that time?
Yeah.
All right, just holler. So she does like the lasers, which I think is probably one of the reasons that, you know, she does still look so youthful. Yeah. So this is one that I thought was funny. She does a salmon sperm facial, which I've actually heard of that. I don't know why people would do that. It just, all of it sounds bad to me. She said even herself that she couldn't tell any difference, but she at least opened up.
She tried it one time?
She tried it.
Or she does it?
No, I think she tried it one time.
Oh.
So I think I've seen those before. I think they're gimmicky. And also
it's kind of like that like vampire facial.
Yeah, I just feel like it's kind of gross. So, I mean, I'm out on that one. Weird. Yeah, we don't offer those in my office.
I swear one time I saw Jennifer Aniston like on like, it was like a round table of like all of these gals that she's friends with, like all of her normal like
Sandra Bullock is one of them, like Reese Witherspoon or something. I don't know.
They're like all of her little friends, like all of them that hang out, and they're all on this like round table, and it was like videoed. I swear she's had like her face just looks like too like I can tell she's had something like injected into her face.
You think Jennifer Aniston's had injections?
Yes, of some sort. Because
she
it's
didn't
like
mention that.
She's like it's too like she looks like this too much.
She maybe have gotten Sculptra. I've never seen a photo of her that I thought she had used like generic hyaluronic acid fillers where you get like the Madonna cheeks that we've seen, or who was the other one? Courtney Cox. Remember she had those really big cheeks? I've never seen a picture of her that she had something like that. Now, that doesn't mean she hasn't gotten some of the alternative ones, such as Sculptra. That's one. It's
like, I know Sandra Bullock. I know
she's got her lips done at some point.
She's done something. Like I feel like her face just looks so like
taut, tense.
Yeah.
Yeah.
And it looks like it's like it doesn't move.
Right.
So that's why I was like, what?
She may have gotten some injectables at some point, you know, along the way, but I don't think they were the filler types.
Yeah.
Because I just have never seen a photo of her where I thought that she looked like she had basic cheek filler, or lip filler.
Yeah, I think you can tell the most, like, if you, like, watch her, like, in whatever movie from, like, the 2000s, like, early 2000s, and then you watch her, like, in a newer movie, you can just see it so much more.
It's different.
Yeah.
Yeah.
Gosh.
So, tummy tuck and lipo, no. Which makes sense. She's never had a pregnancy.
Yeah.
So, that's the thing that really causes women to need, especially tummy tucks, but even potentially lipo. Okay, rhinoplasty. She's for sure had a rhinoplasty.
Yeah.
When you look at pictures of her when she was young, and then you look at pictures of her like throughout the years, her nose has changed. And I didn't include the rhinoplasty pic. I forgot that one, Brenna. I had a really good one. You're gonna have to take my word on this one. I had a side by side, and I don't think I uploaded it because the next one is her just looking great in her bathing suit, right, Brenna?
Yes.
Yeah. Oh, okay.
That's one of my favorite movies that she's in.
Well, we
with
might
Adam
be able to
Sandler.
compare it. Look. Let's look at that picture of her from Friends.
This is a picture
That's
from
her. That's
a
how she
movie.
looks today. She looks amazing. Her body is.
That's from like 2000.
That one?
That one's like from like 10 or 15 years ago. That movie's old.
Wait, I don't think that was a movie, was it?
Yeah.
That was a movie pic? No.
Yes, that is from
Sounds like
her
a photo
movie,
shoot.
from Adam Sandler's movie, where she's a dentist.
Oh.
And she's his
and
assistant.
she's the assistant.
And
That's
then,
from the movie?
Yeah, that's her, because he takes her on
that
vacation.
was mislabeled then. Someone.
That was like one of my favorite movies.
That is a good movie. I know which one you're talking about. Okay. Well,
'Cause
anyway,
they go to
so
Hawaii.
if you look at her nose right there.
Yes.
All right, just get a mental image of that in your head, and now go to the title screen again. Yeah, you can definitely tell it's thinned out. And so she admitted, because for years she said she'd never had a rhinoplasty. And then she finally admitted that she did have a rhinoplasty to correct her septum, which is, that's kind of code for, I got a rhinoplasty, but I want to say that I did it for medical reasons.
Yeah.
Now, to be fair, there is the occasional person that has a weirdly deviated septum that...
What does a deviated septum really do?
So,
Does it just like cause issues breathing?
Yes.
Okay.
So in between your nasal passages, the nasal septum, and so if it gets moved over to one side, it'll occlude one of your nasal passages.
Does it like
I'm
make people
convinced
sound?
I have that.
You think you have it?
I think so.
All right, you know how you test? All right, here's how you test it. So plug one of your nostrils.
The bad one or the... Or
Either one, yeah.
Okay.
So plug one, then suck in through your nose.
I'm gonna give ASMR.
Do that, and then do the other side. Is there a difference? Can you tell the difference?
Yeah.
Yeah. So you probably
Does it make people sound nasally?
It could.
I think I'm like a mouth breather when I sleep.
You
And I
c-
think that's part of it for me.
You could either have a deviated septum, or sometimes people will get inflamed turbinates, which is the soft tissue in your nasal passages.
Yeah, I get frequent nosebleeds a lot too.
Oh, really? It may be
Yeah.
related to that.
It's been better recently, but sometimes it's like seasonal.
Yeah,
When
seasonal
I'm in
allergies,
Florida,
sure.
If I go to Florida, I don't know why, but I have like nosebleeds all the time there. So.
Yeah. Yeah. If your septum's deviated, that is fixable. It's rare to get a deviated septum just for no reason. Typically, septums are deviated from getting hit in the nose. If you fracture your nose, it's very common for the septum to deviate.
Oh, you're just not like born with it?
Anything's possible. Anything's possible. But
Okay.
typically, no. Typically, it's pretty straight.
Who's been hitting you in the face?
Have you ever got hit in the nose, Brenna? Are you a fighter?
No, I was a dancer, but
Not
I
hit in the
played
face?
basketball when I was like little, like second
Yeah,
grade.
maybe.
but
Maybe you got hit in the face with a
clumsy,
ball.
I've
maybe.
got hit in the
Definitely
nose.
been hit in the nose for sure.
I've got hit in the nose a few times. But I don't think my septum's deviated because I've gotten CT scans, and I probably would have noticed it if my septum was deviated. I've never
Yeah.
broken my nose that I know of. Yeah. So she has had a rhinoplasty, at least one, if not more. And you can tell that when you look at her early films and you look at her day. Her nose looks totally different. But she does look amazing. And part of the reason she looks so amazing is she is very religious about working out. She says she still, to this day, does five days a week workouts. They're very intense. She has like this whole routine. And, I think the combination of her taking care of her body to make her body look young, and then doing simple things like, maybe Botox, maybe not, doing, lasers, periodically, hydrofacials. I mean, that plus her just good genetics. I mean, I don't think she's had a lot of surgery. People are saying, oh, she's had a facelift and all this stuff. I'm like, no, she hasn't. She just is good genetics, and she's taking care of her body, and she's doing maintenance stuff, and it's paying off. So
yeah.
So I think it's cool though that she at least kind of opened up, because I think historically she hadn't talked about it a lot.
No, I think the nose job situation from back when she was on Friends was like, okay, I guess we just won't ask her about this anymore because she's obviously lying.
Still not going to say that I did.
Yeah.